Hello everyone. I hope I am clearly visible audible to you guys. Let me confirm if I am clearly visible audible, I will start the class ahead. Give me a minute to confirm it. Okay, just a second. I hope it is working. So I welcome you all for today's session. I am Dr. Priyanka Sachdev here. I'm an educator on an academy, and today I'm here to continue my series which I have started in community medicine, that is epidemiology. In epidemiology, we have already covered the basics of epidemiology. We have seen what are the measures of mortality, and we have already covered what are the measures of morbidity. What are the measures of morbidity? In the last lectures, those who have missed it, they can watch the recording. We have already covered it. The measures of mortality, there are 6 types of measures of mortality, and for morbidity, the only 2 measures are present: incidence and prevalence. And we have seen the difference between rate, ratio, and proportion. So after covering the basics, we have started epidemiological studies. Give me a minute. Let me move to the epidemiological studies. Just a second. In epidemiological studies, we have already seen how many types of studies are there. Okay. So we have seen, this is the basic classification of the studies. Just a second. Yeah. So epidemiological studies are of 2 types: observational studies and experimental studies. Observational studies again of 2 types: descriptive and analytic. Right. We have seen that. So in observational study, the investigator, the epidemiologist will not intervene in the natural course of the disease and will only observe the situation closely. Right. It is of 2 types: descriptive and analytic. In descriptive, the hypothesis is formulated. Hypothesis is formulated, it is framed, right? And in analytic, the hypothesis is tested. So today I will teach you analytic studies. In analytic studies, there are 4 types of analytic studies. Basically, we will concentrate on 2: case control and cohort. How to test the hypothesis. And after that, the experimental studies is the last step, in which the investigator or the observer will intervene in the natural course of the disease, right? Either by adding a drug or a new vaccine, or by subtracting it, right? So that is the experimental study, in which the hypothesis is confirmed. The hypothesis is confirmed. Now, after these 3 studies, there are 2 possibilities. Either the hypothesis is accepted or the hypothesis is rejected based on the situation where whether your hypothesis is right or wrong. Have you got it? That is the basics of epidemiological studies. We have already covered descriptive studies yesterday. So in descriptive studies, we have seen, first we have to define our population in terms of total number, in terms of gender, in terms of age distribution, in terms of other cultural characteristics. We have to define the population. After defining the population, we have to define our disease. Just suppose we took an example: smoking leads to lung cancer. So our disease is lung cancer. So give a operational definition of disease for the diagnosis. After that, we describe our disease under time, place, person. That is the most important step in descriptive studies. Among time, place, person, 3 things we have to see. Right? In the time, we have seen all diseases follow one of the course. Either there are short-term fluctuations in the disease, either there are long-term fluctuation in the course of the disease, or there are periodic fluctuation in the course of the disease. Short-term fluctuations are known as epidemics, right? Long-term fluctuations are known as secular trends, and periodic fluctuations are there. Short-term fluctuations are of 3 types. We have covered it yesterday. It is point source, it is continuous source. Point source or single source is the first one. Continuous source is the second one. And the third one is propagated. We have seen the examples of each of them, right? So point source, the exposure is very brief. What were the examples here? Anyone can tell me? Bhopal gas tragedy, Chernobyl tragedy in Ukraine, in the Chernobyl radioactive nuclear accident, that is Chernobyl tragedy, right? After that, there is Minamata disease of Japan and food poisoning. So these were the 4 examples I have given you for the point exposure, in which exposure is only for a limited period of time. After that, for continuous exposure, we have seen many examples of contaminated well containing Vibrio cholerae. So at every time, different people are coming consuming the water of that well and having diarrhea. Here all the population is affected at the same time in one incubation period. So no secondary waves and one incubation period is there. Here multiple incubation period is there and secondary waves are there because source is always present, right? And in propagated it is like COVID. The person infected, the case will become the source of another person. So it will be transmitted from person to person. That is propagated. We have seen the examples. Long-term fluctuations are of two types, either increasing trend or decreasing trend. So down the line, if you see down the line 10 years, 5 years, some diseases are going to be increased. Like cancers in India, they are increasing. Lung cancer is increasing. Diabetes is increasing. CVD is increasing. But some diseases are decreasing like infectious disease, they are decreasing, right? Periodic diseases are also of two types, either seasonal periodicity, some diseases are common in summer, some are common in winter, some are common in spring, and there is that is seasonal periodicity, and one is regular periodicity, that diseases will occur in particular after many years. So we have seen time. After that, place. In the place we have to spot map and see where is the clustering of the cases, and last is person. So once the descriptive studies are over, let me start with analytic studies today. The most difficult topic of epidemiological studies is analytic studies. Give me a minute, let me come on the analytic studies. In analytic studies, there are four types of analytic. We will test the hypothesis. Hypothesis is already formulated or created. Now we have to test it. So let me start analytic studies now. That was a review of the last lecture. Let me start with analytic studies. So in analytic studies, it is the second step of the epidemiological studies. We will not formulate, it is already formulated, the hypothesis, but we will test the hypothesis. Here we are testing the hypothesis, right? So it is of four types: case control, cohort, cross-sectional, and ecological. We will cover them one by one. So what is the difference between the first two? The first two are the most important, case control and cohort. So it is very difficult topic. I urge you to please concentrate on your gadgets. Listen, take the example. Every time we will take this example only. What is our example? Smoking leads to lung cancer, right? So here smoking is a cause, or smoking is the risk factor, or smoking is the exposure, whatever you say. Either you say smoking is the cause of lung cancer, right? Smoking is a risk factor for lung cancer, or exposure of smoking leads to lung cancer. One and the same thing. And lung cancer is a disease. Our disease under study is lung cancer, or it is the effect. Cause leads to effect. So smoking leads to lung cancer. It is in the same way. So in this ideal example, I have to prove it. It is not proven yet. Although it is proven, just forgot it is proven. You are the one who are going to prove it for the first time. So how you will prove? This is a hypothesis. It is not accepted yet. So you have to test your hypothesis by case control and cohort study. For this hypothesis, you have to perform two studies, case control and cohort, to prove it. Have you got it? Just a second. Let me see. So you have to prove this hypothesis. How you will prove your hypothesis? Okay. Uh, what do you mean by association? There is a word known as association. Association. What do you mean by association? It is an English dictionary word, association. So is smoking is associated with lung cancer? What do you mean by association? Anyone from the audience? What do you mean by association? Association, the meaning of association is not by chance. Any two things occurring together, and they are not by chance. They are occurring together. No, they are not by chance. They are actually together. So whenever there is smoking, it will lead to lung cancer. This hypothesis, the two things in the hypothesis, that is the cause and the effect, they are not by chance. They are not. So you have to prove actually there is an association between the smoking and a lung cancer. So the person who smoke more, there is more probability of having lung cancer in those persons as compared to another person who is not smoking. So you have to prove the association statically. So you have to prove association between the cause and the effect statically by case control and cohort study. So case control and cohort study will prove the association between the two. So association ka meaning they are not together by chance. They are actually together. It is not by chance ki smoking leads to lung cancer. No, you are proving it statically. There is an association between them. And the second thing, what is the stress? So first thing, whether association is present or absent between the two things. Between the two things, whether association is present और एब्सेंट, स्मोकिंग एंड लंग कैंसर के बीच में एसोसिएशन है कि नहीं है? यदि है, इफ एसोसिएशन इज प्रेजेंट, what is the strength of association? What is the strength of association? How strong association is it? So a person who is smoking one packet of cigarettes every day will have more chances, or a person who is taking 5 packets of cigarette every day? So of course the person taking 5 packets are having more chances of having lung cancer as compared to another person having 1 packet only. So it is the strength of association, how strongly smoking is related to the lung cancer. So all these studies will require for two things. Number one, whether statistical association present or absent. If present, then what is the strength of association? So you have to answer two things, by case control study also, by cohort study also. So these are the two answers you have to give in each of them. Whether association between the cause and the effect present or not present. And if association is present, what is the strength of association? You got it? You got it? Give me a thumbs up if you got it. So let me start with the case control and cohort. I will teach you all four, but these two I will teach you a little bit detail with the examples, formulas and numerical, right? Okay, let me start with case control. Let me take the same example, case control. Okay, this is the chart. So to explain this chart, let me frame an example. The example is in front of you. The example is in front of you. So 2020, make it 22. 2022. So this year is 2022, February, right? So you are the investigator. You want to prove smoking leads to lung cancer and you want to do case control study for that. By case control study, this is your hypothesis. Smoking leads to lung cancer. You are an investigator and this is your hypothesis. You want to prove your hypothesis to the world that this is right. But you have to prove it statically. Yes or no? You have to prove it statically. So what is it? It is 2022 now, February. So you will say, okay ma'am, I will perform a study, case control study. What you will do actually in the study, you will sit in your office at your area, you will call 100 lung cancer patients in your office. So these are the cases. What is the definition of a cases? The person in which disease under study is present, right? So all have lung cancer. So you called them, you requested them to participate in the study. It is free of cost. It is for the benefit of the community and they should participate. And they all are ready. They are coming to you. Okay, we will participate in the study. So you are having 100 cases with you, right? 100 cases means 100 persons who have lung cancer. So in that, disease under study is always present. I don't know about other studies, diseases. I don't know whether they are diabetic or not, whether they are hypertensive or not, whether they are tuberculous or not, but they have lung cancer. They all disease present. Disease under study. By disease, I mean the disease which is under study. My disease under study in this example is lung cancer. So these all are 100 cases. Imagine they all are present at your office, at your workshop, right? So where you are doing this experiment. Okay, you have called 100 controls also. What is control? In which disease under study is absent. They are healthy people. Healthy people are known as control. By healthy people, I mean, what is the disease under study? Here in this example, it is lung cancer. So they do not have lung cancer. They do not have disease. By disease, I mean they do not have lung cancer. Maybe they have diabetes. Maybe they are hypertensive. Maybe they have some other disease, but it is not lung cancer. So these are my 100 cases. These are my 100 control. I called them and asked them, all cases please stand on this side. All controls please stand on this side. So I am having 100 cases with me. Cases means disease under study present in them, and I am having 100 control with me. Control mean disease under study is absent in them. So these are the diseased people, these are healthy people, right? Disease present, disease absent. These are 100 cases, these are 100 control. What I will do now, I will start with cases. I will call them one by one in my office, in my office, and ask them the history. Ask them the history that these are the cases now. They are diseased person. They already have lung cancer. They are on treatment. They are on treatment. They are on chemotherapy. They are on radiotherapy. They are on treatment. So I will ask them. I will take the history whether you are smoker, yes or no. So they will say currently we have lung cancer and we are diagnosed lung cancer. So we have quitted the smoking. Most of the person who have lung cancer, after having lung cancer, they quit the smoking because they are on chemo and they are on radio and they already notice harmful for us, and that smoking leads to this cancer. So they are very troubled, they are crying, actually they are not happy because they have suffered a lot, and they will say yes, we were quitting, we were smoking, I was smoking, but now I don't smoke. So okay, he was a smoker, but after disease diagnosis he has quitted. So you take a history. Just suppose out of 100, 70 were smokers and 30 were non-smokers. So it can happen. So 70 people were say, yes, we smoked previously, but now we are not smoking, or currently also we are smoking, whatever. So consider all of them as smoker. So you have to take the details history from how many years you were smoking. In one day, how many cigarettes or bidi you are smoking, whether you are taking cigarette or bidi or pipe, what you are smoking. So you have to take all the details, right, for the strength of association. Okay, you have taken, and there may be just a few, for example, say 30 people who will say no, we don't smoke and still we have lung cancer. We are the most unluckiest person, we never smoked, still we have lung cancer. Okay, we have taken their history also. So this study is based on history. We are trusting people that they are saying truth, they are saying truth, right? Maybe they are lying, I don't know. Maybe a smoker is this, and whenever I am asking do you smoke, he's saying no. So there is no confirmation of it. Verbally only I am believing the people. Whatever they are saying, I am considering they are saying true. They are saying it true and they are not lying to me. So it is the drawback of the study. Right. Okay. Let me come on control. So I have taken the history of all 100 one by one. I will say them. I will take their phone number. I will take their address. I will take their email ID. I will fill the form from each of them and I will let them go. So all of the 100 cases I have given forms to fill, and I have taken an interview of them, and I have in the interview I have interrogate them about the history of smoking. In the form also I asked them to fill the history. So some of them are saying yes, we are smokers, some of them are saying no, we are not smokers, and they all have lung cancer. They all are the cases, right? So we have taken their contact number and asked them to go back. Thank you for participating in the study. Okay, and come on the control side now. In the control side also, one by one I called everyone and asked the same history, whether you are smoker or whether you are a non-smoker. So just suppose out of them, the 10 are the smoker and 90 are non-smoker, but they didn't have lung cancer yet. All 100 are healthy. All 100 are healthy. The figures can vary. This is just an example to explain you. Have you got it? Have you got it? What does it mean? So there are four groups of the people. There are four groups of the people. What are the four groups of the people? What is the 70? These 70 are the smokers and they have lung cancer. These 30 are non-smokers. They still have lung cancer. Right? These 10 are smokers, but they do not have lung cancer. They will laugh. See, we are smoking, still we don't have anything. So these are the 10% who smoke, but they don't have lung cancer. They are healthy. And these 90 are non-smokers and they are also healthy. So we have divided the entire 200 persons, 100 cases and 100 controls under four categories. Do you have any doubt in this? And it is based on history. History is the thing that you are interviewing them, you are asking them, and the person can lie always, and there it is based on the memory of the person. It is based on the memory. It is observed that what is the drawback of this study? The drawback of this study is that the cases can do a better recall of the past as compared to controls. The cases are the one who already have the disease. So when you ask them that you already have lung cancer, we know, we can see your reports, we are doctors, right? Now you tell me true that whether you smoke in the past, yes or no. So they will start crying, yes doctor, it was my, I'm very unfortunate, I was not knowing that smoking will lead to me at this stage. Yes, I am a smoker. So they have a better recall because they are suffering from the disease, which the cause which leads to that disease, and they are very unhappy right now. Have you got it? They are very unhappy right now. So the recall is better. But when you ask the control, they all are healthy, they are not suffering, they are happy in their life. So when you ask them for recall, they will say I don't remember, and so they don't have a better recall, right? So it is a psychological thing. So it is also a drawback of this study. Anyways, you have divided the person into four categories. Let's call this 70 A, small a, this 30 as B, this 10 as C, and this 90 as D. What is ABCD? What is ABCD? See the study pattern, it is going in the past. Just a second, let me see. uh just a second. Yeah, so you are starting from this point. From the population, you took 100 cases. From the population, you took 100 control. What are cases? Cases are the person with disease. What are controls? Control are the person without disease. Without disease means without disease under study. You are taking the history from them also, and you are taking the history from them also. The history is about exposure of the risk factor. So whether you smoke, yes or no. So among these 100 cases, some of them are smoking, that is exposed. Call this category as A. And these are non-exposed, call this category as C. So it is 70 in our example, it is 30 in our example. In our example, 70 and 30, right? But all have lung cancer, right? Among the control, there are some person who smoke. In our example, it is 10. And there are some person who do not smoke. In our example, it is 90. So it is 10 and 90 here. So I'm calling A as 70, C as 30, B as 10. It is an example, right? So we divided people into 4 categories, A, B, C, D. Have you got it? Have you got it? Give me a thumbs up if you got it. Give me a thumbs up if you got it. Yes or no? So make a table. How you will make a table? So please understand how to make a table here. So disease, always take disease at the top. First present, then absent. And always take exposure or risk factor at the left side corner. Present, absent. Always take present first, then absent. Divide in 4 columns. What are the 4 columns? Please learn how to divide in 4 columns. Okay, these are the 2 columns, and okay, these are the 2 columns. So these are your 4 columns. Let's fill these 4 columns. This, this, this. So disease is at, please understand, it is difficult. Again, I am saying it is difficult. I am trying hard. So disease is always at the top. Present, absent. First present, then absent, right? And exposure is always on the left side, left hand corner. Present, absent. So these are the person, everyone see, these are the person in which exposure means smoking is also present and disease is also present. So they smoke and they have lung cancer. They smoke, so it is A. We divided it into A now. This is A category. Call it as A. This is A. Have you got it? So exposure is present, disease is also present. It is A. This is the group of person who smoke. Exposure is present in them, but they do not have lung cancer. So these are C. Exposure is present, but lung cancer, this is B. Lung cancer didn't present. These are the person in which exposure is absent, but disease is present. So they call them as C. And these are the person in which smoking is absent and this is also absent. Lung cancer is also absent. Have you got it? So call them as D. Just a second. Call them as D. Do you have any problem in understanding it? So these are A, B, C, D, 4 categories I have taken. Understand one thing both. So A is the person in which both are present. They smoke also, they have lung cancer also. D is the person in which both is absent. They do not smoke and they do not have lung cancer. Have you got it? They do not smoke, they do not have lung cancer. A is the person, they smoke, they have lung cancer. D is the person who do not smoke, who do not have lung cancer. Do you got it? Do you got it? Yes? Yes or no? B is the person who smoke but do not have lung cancer, and C is the person who do not smoke but have lung cancer. So this is how you have to understand this table. This is how you have to understand this table. Let me proceed. If you don't have any doubt, let me proceed. So we have divided the person in this way. The 4 categories A, B, C and D. In A, both is positive. What both things are positive? In which exposure is also present, disease is also present. In D, both are negative. Exposure is absent, disease is absent. In B, exposure is present but disease is absent. In C, exposure is absent but disease is present. You know what is exposure and disease here. Have you got it? These are the total cases, A plus C 100. These are the total control, B plus D again 100. So total study is done in 200. 100 are cases, 100 are controls. So this is case control study. Give me a thumbs up. Give me a thumbs up. You got it, Mahesh? You got it? So that is case control. So smoking leads to lung cancer. You want to prove it. You want to. So that is the basic design of case control. How to do the numericals based on that and what is the analysis, I will come on that later on. So let me tell you the plan of cohort. How does cohort studies are done? Cohort studies. Listen. Okay. Again the same example. Case control example. Just a second. Again, I will take the same example. What is the same example? Smoking leads to lung cancer. So, okay. Now, I will start my study again with 200 people. But here, 100 are smokers. I will call 100 smokers in my office, not lung cancer. And I will call 100 non-smokers in my office. The person who already smoke, I will consider them as smoker. I will not ask anything, you please smoke, you please don't smoke. No. If you are smoking, you are already smoking. It is not on my wish, right? So you please participate in my study. So you are a smoker. You are a chronic smoker. And the person who do not smoke, you are a non-smoker. So in them exposure is present. In them exposure is absent. So let's start it. 100 smoker and 100 non-smoker. And take their email ID, address, phone number. Ask them to fill the form and go to your home. Now call them every month. Do you have lung cancer? Do you have lung cancer? Do you have lung cancer? Each and everyone. And follow them for the next 10 years. Next 10 years, 15 years and 20 years. After 10, 15, 20 years, it may happen that out of these 100 smokers, 70 or 90 have lung cancers after 10 years. and 10 will not have lung cancer, will not, no lung cancer, no lung cancer. Out of these 100 non-smoker, it may happen that only 10 have lung cancer and 90 have no lung cancer, whatever may be the figures. So after 10 years, you have to, now during, what is the drawback of this study? So this study, we are going in future. Remember, the case control, we were going in past. We were taking the history, and here we are going in future. That's why case control study is retrospective study and cohort study is prospective study. In case control, we are going in the past by taking history, and in cohort study, we are following, we are doing the follow up, we are doing the follow up, and we are going in future. Here it is not based on memory, we are not taking any history, it is not based on truth and lie, right? So we are not trusting people, we are actually following them and asking them, do you have lung cancer? If they say yes, we will go and check at their home, do you really have lung cancer? So you were a smoker 10 years ago, you came to our office and you said you are a smoker and you have lung cancer now, right? So you are doing the follow up. Now what is the advantage of cohort study over case control is that it doesn't depend on history. So it doesn't depend on memory of the people, it doesn't depend on truth and lie of the people. You are not trusting people, you are actually following them. The drawback is that follow up is costly. Taking history was easy, you were just asking them and writing whatever they are saying. But follow up every month, either you have to call, either you have to send the email, and you have to keep a check on these 200 people. So it is costly. Number one, it is costly. Number two, it is time consuming. It will require the 10 years ahead. If you want to take history, you can take in one day. So case control study can be closed in one day, but cohort study requires years for follow up. So it requires many years. That is the drawback. So it is costly and it requires years, but it is more authentic. It is more authentic. The third drawback is that during follow-up, there is some of the people who lost. Some of the persons under experiment, they are lost. Like they will change their address, they will change their phone number, and they will not share your new address and phone number. So it is the lost during follow-up. So during the 10 years, you can lose many of them, right? You can lose many of them. Have you got it? So these are the drawbacks. So the advantage there will become disadvantage here, and the advantage, so that was cheap, but it is costly. But that was based on memory. Here, no memory is required, right? It is based on follow-up. There was no follow-up. So the advantage there are disadvantage here. The advantage here are disadvantage there. That was a fast study. It is a slow study. It requires 10 years. It requires few days, right? So you have got it. So वहाँ हम start कर रहे थे from 200 people, 100 having disease, 100 do not have disease. That is cases and control. Here we are starting with 200 people, 100 are smoker, 100 are non-smoker. Again, we will divide them in 4 categories. So you can see we are going in future. Starting from the population. From the population 100, we took who are exposed. Exposed means they smoke. They are the smokers. And 100 are non-exposed, means they are non-smoker. And we are doing the follow-up for the next 20 years, 10 years, whatever. So after follow-up, we are saying out of these 100, how many have disease, how many do not have disease. Call them as A and B, right? All of them smoke. Smoker to sare hain. From the smokers, some will have lung cancer, some will have no lung cancer, right? And here, all of them are non-smoker. All of them are non-smoker. Out of these non-smokers, some will have lung cancer and some will have no lung cancer. So call them as C and D. So we are dividing the entire 200 people we took from the population into ABCD. This 100 is just for the sake of example. Better, larger is your sample size, better will be your results. More authentic will be your results. So instead of taking 100, you can take 1,000, 1 lakh or more population, right? So जितना sample size बड़ा होगा उतना आपके results more authentic होंगे. Have you got it? So we are going in future. So this is the design for cohort. Now compare them. Compare them. So you can see this is case control and you can see this is cohort. In case control, you were starting 200 people here, 100 cases, 100 control. 100 cases, 100 control. And you are going in past by taking history. Here history was the key, right? Here you are starting with 200 people, but 100 are smokers and 100 are non-smokers, and you are going in future by doing follow up. So here we are doing history, we were taking history and going in the past. Here we are doing follow up and going in the future. So this study is known as retrospective study and this study is known as prospective study. I tried my best. Everyone give me a thumbs up. Have you got it? Please give me a thumbs up if you got it. So these are the two study design. If you have understood the design, now it is easy for you to understand the formulas and solve numericals on it. So that is all about case control and cohort study. Have you got it? Give me a thumbs up. Anyone who is listening to me, please give me a thumbs up if you got it. Okay. So these are the two basic study designs. Now many numericals from them come in your exam. So we have to do the analysis. Now in each study we have to answer two things. What two things we have to answer? Number one, is there is any association between smoking and lung cancer? If association is present, what is the strength of association? We have to answer these two questions here also by solving the numericals or proving our hypothesis, and the same two scenarios here also. So here in the first case, in case control, so there are four groups of population. Now we are dividing the population into four groups. So if the number of exposed people are more in cases as compared to exposed in control, so it will be proven. I mean, if you find that यहाँ पे स्मोकिंग का परसेंटेज आपका 70-30 है, यहाँ पे 10-90 है, तो यहाँ पे 70% of the people smoke out of the one who have lung cancer. Here only 10 are smoking. So you have to take that percentage, that is known as exposure rate. That will prove if it is more in cases as compared to control, your hypothesis is proven. On the other way around, in cohort study, you will find the incidence rate of the disease. If the disease is occurring more in exposed person as compared to the disease in non-exposed, here it is 90-10, it is 10-90. If it is proven like that, so you will be able to prove your hypothesis. So we will do the calculation, but not now, in the next lecture. So thank you very much for being with me. Let me end here. Just a second, you have to wait for a minute. So thank you very much. I really enjoyed teaching you these basics. If you know these basics now, it will be very easy for you to understand. My next class is today at 12:15 p.m. afternoon. Today, it is a special class on Unacademy. I am going to teach you clinical scenario questions from cardiovascular system in pathology medicine. It is an integrated session. The questions will be next pattern, the pattern of the next which is going to happen. It will be an integrated session. So it is a free class. Everyone can participate in that. So I request you to come in that class. Thank you very much. And on Unacademy, we have two type of subscription, Plus and Iconic. In Plus, you will get access to live and recorded lectures of Unacademy only. In Iconic, along with Unacademy, we will provide you prep readers also, right? NEET PG notes are already out. And if you want, Unacademy is providing these hard copy of the notes. You can take it, right? You can order your notes. And these are the once you take the subscription, these are the batches you will be eligible for. You can check the plans of the Plus, and you can check the various plans of the Iconic on your app. Whatever plan suitable to you, you can purchase that plan. The minimum is 3 months, maximum is 4 years. You can see, you can check the prices of various plan. You can notice one thing: longer the plan, cheaper it is. Longer the plan, cheaper it is. So if you are a first prof, second prof student, go with a longer plan. And if you are a final year student or an intern, you can go with a shorter plan also. Whatever plan you are choosing, if you apply my code SACHDEV, Sachdev10, before payment, you will get maximum discount. So please don't forget the code and join me back today in the free class, free special class on Unacademy platform. Thank you very much. Study hard.